Welcome to the R-Series defibrillation module.
In this module, you will learn how to operate the R-Series with hands-free defibrillation electrodes in AED mode and in manual mode. Manual mode includes advisory defibrillation as well as manual defibrillation. This module will also cover how to defibrillate with paddles in manual mode.
Before starting, verify that the R-Series defibrillator is ready for use by noting the green check mark on the defibrillator front panel. If a red X is present, one person should attempt to deliver therapy using the defibrillator, while another person runs to get a defibrillator with a green check. Throughout the defibrillation process, it is important that you pay special attention to minimizing interruptions in chest compressions, especially when you are placing the defibrillation electrodes on the patient. While one person continues compressions, the other should remove the one-step resuscitation electrodes and apply them to the patient. Complete details on electrode application are covered in the Prepare Patient module. As a reminder, always place the back electrode on the patient first. The front electrode should be placed so that the red line on the CPR sensor is in alignment with the patient's nipples. Once you have placed the electrodes on the patient, you can begin defibrillation.
To begin AED mode, turn the mode selector to On. The word AED will light up in green, and ECG analysis will automatically begin. Automatic analysis of a patient's ECG can be performed only when hands-free electrodes are attached to the patient.
If the defibrillator confirms a shock is advised, make sure the environment is safe for defibrillation. To do this, remove high concentrations of oxygen from the patient. Confirm that no one is touching the patient. Loudly warn all persons to stand clear, and look to make sure all persons are clear of the patient, the bed, and any equipment connected to the patient. I'm clear. You're clear. Everyone is clear. Follow the voice prompts. The defibrillator will charge and the shock button will illuminate. Press shock. Begin compressions immediately after you have delivered the shock. After 2 minutes of compressions, the R-Series Plus will automatically analyze the rhythm. Repeat this sequence until the end of the resuscitation event.
The R-Series is designed to work with a family of one-step electrodes. The advanced features of the one-step family include code-ready connectors that ensure code readiness. An expiration alert notifies you when the one-step electrode has expired. In addition, the R-Series can also be used with Zoll specialty pads, CPR stat pads, paddles, and internal handles. The one-step complete electrode combines all the features of the one-step basic, pacing, and CPR electrodes, including one-step pacing, real CPR help, code-ready connector, and expiration alert. The one-step pediatric electrode is designed for patients under 8 years of age. It automatically decrements the R-Series joules to pediatric settings. If you need to place one-step electrodes on the patient, open the electrodes by grasping the cable and pulling back the top. Notice that the multifunction cable should already be attached to the electrodes.
To apply the electrodes, roll the patient onto his side. Grasp the rectangular red electrode labeled 1 and peel it from the plastic liner. Place the electrode onto the patient's back to the left of his spine and under the scapula. Roll the electrode onto the patient's skin to eliminate air pockets. Make sure you always apply the back electrode first to prevent buckling of the front electrode. To apply electrode 2, roll the patient onto his back. Grasp the triangular blue electrode labeled 2 and peel it from the liner. Roll the electrode onto the patient's left chest with the blue triangle midway between the sternum and nipple. If you are using the one-step CPR or one-step complete electrode with the compression sensor, place the sensor on the patient's chest so the vertical red line is mid-sternum and the horizontal red line is between the patient's nipples. If your patient is female, lift up the breast in order to attach the electrode underneath. Avoid any contact of the electrode gel with the nipple. If possible, do not place the electrode on skin folds. If you are using the one-step CPR or one-step complete electrode with the compression sensor, place the sensor on the patient's chest so the vertical red line is mid-sternum and the horizontal red line is between the patient's nipples.
Patient preparation using multifunction electrodes. The family of one-step resuscitation electrodes are designed to work with the R-Series. There are electrodes for every need, including specific electrodes for pediatric patients. The advanced features of one-step resuscitation electrodes include automated self-tests, code-ready connectors, and electrode expiration alerts. The R-Series can also work with Zoll specialty electrodes, internal handles, and paddles. You can also use standard 3-lead or 5-lead ECG electrodes for monitoring your patient. Multifunction and ECG electrodes must be placed on clean, dry skin. Clip excess hair whenever possible. One-step electrodes should remain connected to your defibrillator at all times. To connect the electrodes to the multifunction cable, slide the cable into the electrode connector. The two largest pieces will connect. They should fit together easily and create a tight connection. To open the one-step electrodes, grasp the electrode packaging at the yellow triangles and firmly pull, separating the two sides. Notice the multifunction cable is attached to the electrodes. To apply the one-step electrodes, place the back electrode first to prevent buckling of the front electrode. Grasp the rectangular red electrode labeled 1 and peel it from the plastic liner. Roll the patient onto his side and then roll the electrode onto the patient's back to the left of his spine and under the scapula. To apply the front electrode, grasp the triangular blue electrode labeled 2 and peel it from the liner. The one-step complete and CPR electrodes include a CPR compression sensor. Place the sensor on the patient's chest so the vertical red line is mid-sternum and the horizontal red line is between the patient's nipples. Roll the electrode onto the patient's left chest with the blue triangle midway between the sternum and nipple. For female patients, lift up the breast if necessary in order to position the electrode underneath. If anterior-posterior placement of the electrodes is not possible, use one-step CPR anterior-anterior electrodes. For children under 8 years of age and under 55 pounds, 25 kilograms, use one-step pediatric electrodes available with and without CPR technology. R-Series Plus. Your institution may use the R-Series Plus defibrillator, which looks a little different than the R-Series you have seen in this video. The R-Series Plus is a fully functional manual defibrillator that powers on as an AED. To begin, turn the mode selector to On. You will notice that the defibrillator says AED. The R-Series Plus will now function as an AED, providing prompts and feedback, including rhythm analysis and CPR feedback. Follow the prompts provided with the visual and audible alerts. The defibrillator will analyze the patient's rhythm. If a shockable rhythm is detected, the device will charge itself and instruct you to press shock. Before shocking the patient, ensure the environment is safe for defibrillation. To convert to manual mode, press the manual soft key on the lower left-hand corner. Depending on your institution settings, you may need to press Confirm. Once in manual mode, the R-Series Plus has all the same features and operations as the defibrillator shown in this video.